And it's a recessive condition. So for example, when a little girl like this is born, what you do know is that her parents, one of her parents is heterozygous with a normal allele for pigment production, and the non-functional enzyme involved in pigment production. Same thing with the father. So when he makes sperm and she makes eggs, you produce a Punnett square, and this will give you the chance of their having another albino child. So if these parents have one albino child, what's the chance they're going to have another one? 25%, right? Okay. Because this is a homozygous recessive condition, we know that the father has to be carrying the what's called the mutant or recessive allele. The mother has to be carrying the mutant recessive allele. They're normal, so their other allele encodes the enzymes making proper levels of pigment, or reasonable levels of pigment. And so you know what his sperm are going to be producing as far as these alleles go. You know what her eggs are producing. And this actually allows you to determine the chance of having a normal child who's homozygous normal, or a heterozygote carrier of the mutant allele, or a affected child. Okay? So this is affected. This is a heterozygote carrier. This is homozygous normal. Okay? We okay? Did I answer any questions or repeat anything? All right. So what we were looking at just now is a recessive disorder. With a dominant disorder, you have another situation. Dwarfism is a dominant disorder. It actually involves a fibroblast growth factor receptor. Remember, we talked about cell signaling and receptors binding their cognate ligands and initiating signal transduction pathways in the cell. So during his period of embryonic and fetal development, he had a fibroblast growth factor receptor that was abnormal. It was abnormal. And what it did was it initiated the process of bone formation too soon. When our bones form, normally it starts out cartilage. It starts out cartilage and then bone takes over. In his case, or in any dwarf case, what happens is the fibroblast growth factor receptor that helps to maintain cartilaginous bone formation before that bone turns to bone, hard calcium-based bone, is this receptor. His was mutant, it was too active, and his cartilaginous long bones turned to be hard bones early in his development, and so consequently, he's only about 3 feet tall. That's the basis of what we call achondroplastic dwarfism, and that's spelled achondroplastic, achondroplastic. Okay? So what you have is, because it's a dominant disorder, because that mutant fibroblast growth factor receptor has a dominant effect on embryonic and fetal development, an individual who's a dwarf has one dominant mutant allele, one normal allele, and if this fellow has children with a normal woman, then his sperm are going to be producing these gametes, gametes that have the normal fibroblast growth factor receptor gene, and gametes that have the mutant fibroblast growth factor receptor gene. And her eggs are producing both normal alleles. And so what's going to happen when you foil them together with a Punnett square is you're going to have half these children would be dwarf, half of them would be normal. One thing you will never see, is an individual with two alleles encoding the mutant fibroblast growth factor receptor. You will not see an individual with two double Ds as their genotype. Do you know why? You never see that. What might be the reason? If you never see a person that actually has two mutant alleles for the fibroblast growth factor receptor that results in dwarfism. You never see that.
So if you have somebody go from A, maybe one go from E, you have a double D, right?
Yes, if this fellow mated with a woman that was a dwarf, yeah, there would be a double D. It would be more like this here. But you never see that. You never see that. And we have, and there are a lot of dwarfs that marry and have children together. Half their children are normal, half of them are dwarfs. But you never see an individual with two mutant alleles for that fibroblast growth factor receptor. Why would that be? It's embryonic fail. Yes, you will not get through your embryonic period if you have two alleles both encoding the mutant fibroblast growth factor receptor. If you don't see it, you never see that, that is the primary reason why. Very good. It's fatal. It's fatal in the embryonic period. So that would result in what's called a spontaneous abortion or a miscarriage. 60% of all fertilizations end up with spontaneous abortion or miscarriage. 60%. That's huge. Okay. And that's one of the reasons why. Okay. All right. And I explained that in this slide here, where if you have an individual with dwarfism producing children with another individual that has dwarfism, this would be the embryonic lethal. This is the embryonic lethal, and it's the fibroblast growth factor receptor number 3, causes premature conversion of cartilage to bone. And the reason why these infants with this genotype are stillborn, they usually, I'm surprised, they don't even make it to birth. It's simply because the rib cage is underdeveloped and cannot support breathing. There are no breathing motions that can occur. Okay. All right. Now I want to talk about another complex pattern of inheritance. It's called pleiotropy. Pleiotropy is a complex pattern of inheritance where you have a single gene, the product from a single gene will affect many different phenotypes of an individual. And an example of pleiotropy is cystic fibrosis. Another example is sickle cell disease. Another example is Huntington's disease. So in cystic fibrosis, this is a recessive abnormality. It involves a mutation in the cell surface transporter. It's a chloride transporter. Chloride transporter transports chloride in and out of the cell. And individuals with cystic fibrosis don't have a functional chloride transporter, and so consequently, their fluids in their lungs are very thick, and they support the fluids in the lungs because they're thick and full of mucus, will support large numbers of bacteria. So individuals with cystic fibrosis have problems with pneumonia, Up until maybe 20 years ago, people with cystic fibrosis didn't live much older than the age of 20. They would just be, their lungs would just be torn apart and worn out from battling with various forms of pneumonia throughout their lives. Now, of course, there are better therapies, and people with cystic fibrosis, depending on the severity of the mutation, these people can sometimes live up into middle age and actually reproduce. That was something that was unheard of 25 or 30 years ago. It's a pleiotropic disease because it affects respiration, it affects strength, muscle strength, because they're not breathing, they can't get in enough oxygen, it affects their overall quality of life. And it also, this chloride transporter not only affects lung function, it also affects intestinal function. It also affects intestinal function. So individuals with cystic fibrosis have problems with diarrhea. I know, but it can be a problem. We all know that. Okay. Then we have sickle cell. Sickle cell is another example of a pleiotropic disease. It involves simply a single mutation where a single amino acid is changed in the beta subunit of hemoglobin. But what it does is it changes the structure of hemoglobin overall such that instead of having a nice rounded red blood cell, you have a sickle-shaped or deformed red blood cell. What this is going to do is it's going to clog the capillaries that feed the tissues. And so consequently, individuals with sickle cell disease, it's pleiotropic because these individuals have a lot of pain. They have problems with function of their extremities because the capillaries that feed the extremities, the fingers, the toes, feet and hands, are not functional. They get clogged with these sickle cell erythrocytes or red blood cells. And then you have Huntington's disease. So cystic fibrosis and sickle cell and cystic fibrosis are both considered recessive diseases because if you have the normal allele, you can get by. The mutant allele is going to affect the individual, but individuals who are heterozygous can get by with both sickle cell and as well as cystic fibrosis. Only when you have both mutant alleles do you show the full-blown disease. Huntington's disease is very similar to the effects of achondroplasia in that this is a dominant mutation. It's a dominant mutation. Huntington's disease comes from a gene that encodes a protein that's expressed in muscle and brain, in other words, in nervous tissue, in both muscle as well as in the brain. It's called huntingtin. Huntingtin, T-I-N. Its actual function is not yet understood, but it's known that individuals who have the mutant allele for the huntingtin protein, that these individuals, by the time they're 40, start to have impaired cognitive function. They also lose motor control. So if I had Huntington's disease, I couldn't just stand here and talk to you. I'd be wandering and dancing all around in front of you with no control over my movements. Okay? And that's actually one of the first indications of the disease. It doesn't hit until somebody is 40, in their late 40s into their 50s. By that time, unfortunately, they have married and reproduced and passed on that unfortunate allele to half of their offspring. Okay? It's a dominant disease, and what happens over time, and this is a normal cross-section of a brain. This is the cross-section of a brain with an individual with Huntington's disease. You can see that there's deterioration. There are large vacuoles or spaces in the brain. It's breaking down. So the brain actually starts to break down. The reason for that The reason for this is because the allele, the mutant allele for the Huntington protein actually will bind, the mutant Huntington protein will bind to the normal Huntington protein and cause aggregations of these proteins to form in the cells of the brain and kill the brain cells. So it's a dominant disease. It's a dominant disease because the product of the mutant allele will interfere with the product of the normal allele. It's a dominant, I'm going to say that again. This is basic genetics. If you understand this, you can apply it to almost everything. So, the product of the mutant allele in Huntington's disease, which is a mutant Huntington protein, that protein will actually bind and prevent the function of the normal protein in the brain cells. It causes aggregations of abnormal protein in the brain cells, so instead of getting a nice normal brain, you get a brain that's started to deteriorate. Okay? That's the basis of pleiotropy. Do we understand this, or can I answer any questions at all? Okay. And this is just talking about the effect of sickle cell, how when you have heterozygote with a normal allele and a sickle cell allele, you're going to get, in individuals who are heterozygotes, you'll have red blood cells that are sickle cell shaped, but at least an equal number or more of the normal red blood cells. And so these individuals are affected. They're definitely affected by the abnormal allele, but they won't show sickle cell disease like you would if you had both abnormal alleles. They won't show the disease phenotype. Okay? All right. Okay, and I will finish. Well, actually, we have a minute left. Can we hang out for a second? So I can tell you it's really interesting. Okay. Knowing what we know about genetic diseases such as Huntington's disease, sickle cell, and cystic fibrosis, if one of these diseases was actually coming to your family, and you wanted to marry a person who had the same kind of family history, that would make you worried, right? Rightfully so. And so if a couple marries and they both have a brother or sister with cystic fibrosis, then they're going to want to know if they're carrying the allele for cystic fibrosis, or if they are carrying the allele, what's the chance they're going to have a child with cystic fibrosis? And that's what amniocentesis can tell you. Amniocentesis is a prenatal procedure carried out about 16 weeks gestation. It involves removing amniotic fluid from the uterus around the fetus and taking fetal cells from that amniotic fluid, culturing them, and then looking at the chromosomes and determining if the disease gene or the mutant gene is carried by this infant. Does anybody know what amniotic fluid actually is? What is amniotic fluid? It's fetal urine. It's fetal urine from the time you're about 7 weeks gestation. Your little kidneys are at work. And where is that going? It's bathing you. Isn't that nice? Okay, I'll finish this on Friday.